Hi everyone, I'm Penny Tillman from Evidence-Based Programs. Today I'd like to talk to you a little bit about one of the tools we use in our workshop called Living Well with Chronic Conditions. The tool is using your mind to help manage symptoms. One of the ways we can use our mind is by establishing a practice of gratitude. And why does this work? Well, research shows that people that practice gratitude have a better outlook on life. They're more optimistic. It improves your mood, makes you feel happier. It can improve your relationship with others. I'm sure that's what all of you would like to have, right? So during these days when we're being bombarded by negative news and everything that's going on with social distancing and isolation, it's even more important to maintain a positive attitude. So one of the ways that we can do that is right here. So when you're feeling that negative attitude hit you, by switching the channel, so to speak, you can improve your mood to something more positive by asking yourself, what are you grateful for? What are you grateful for? 1, 2, 3. You can just say it right off the top of your head. Look around, calm yourself down, and think, what am I really grateful for? What do I appreciate? Another little thing that you can do is make a gratitude jar. My daughter made one of these. Cut up little pieces of paper, and at night, just drop them in the jar. By the end of the month, you'll have a whole jar full of things that you're grateful for. That's pretty cool, right? So just want to remind you that by changing the way that you think about things and about life and about your situation, it can actually have a positive outcome for the stress that's in your body. Your body will be able to handle stress in a more useful way, or maybe you'll even be stress-free, right?
Hi, I'm Angela James at the Centers for Medicare and Medicaid Services, and I'd like to tell you about the different parts of Medicare. Medicare is health insurance for people age 65 or older, people under 65 with certain disabilities, and people of any age with ESRD or end-stage renal disease, which is permanent kidney failure that requires dialysis or a kidney transplant. There are 4 parts of Medicare: Medicare Part A, B, C, and D. Medicare Part A, or hospital insurance, helps cover things like inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. Medicare Part B, or medical insurance, helps cover things like services that you get from doctors or other healthcare providers, outpatient care, home health care, durable medical equipment, and some preventive services. Medicare Part C, or Medicare Advantage, is another way that you could get your Medicare coverage. Now here's what you need to know about Medicare Advantage plans. They're run by Medicare-approved private insurance companies. They include all the benefits and services covered under Part A and Part B. They sometimes cover extra benefits and services for an extra cost, and they usually include Medicare prescription drug coverage, which is called Part D. Now speaking of Medicare Part D, let's take a look at some of the basics. Part D plans help cover the cost of prescription drugs. And like Medicare Advantage plans, they're run by Medicare-approved private insurance companies. If you don't join a Part D plan when you're first eligible, and you don't have other creditable prescription drug coverage, you may pay a late enrollment penalty if you choose to join later. Creditable drug coverage is prescription drug coverage, like from an employer or a union, that's expected to pay on average at least as much as Medicare's standard prescription drug coverage. With Medicare, you get to choose how you get your coverage. You can choose Original Medicare, which includes Part A and Part B coverage. And if you want prescription drug coverage, you must join a separate Part D plan, or you can choose to join a Medicare Advantage plan, where you'll get your Part A and Part B coverage from the Medicare Advantage plan, not Original Medicare. The Medicare Advantage plan may include Medicare prescription drug coverage. Now, this is just basic information about your Medicare options. You'll need more detailed information to make an informed choice. And before you make any decisions, learn as much as you can about the types of coverage available to you. To learn more, visit Medicare.gov.